I think Dr. Moffat hit it a while ago when he said the devil's in the details. I think one of the things we're trying to do today is how will small providers be impacted by what's going on, and until we know a little more in detail about what's going on with the budget, we're kind of like throwing darts with a blindfold on here. I think it's a little difficult to get our hand around this issue, but I certainly appreciate all of you being here today and giving us your concerns and your input, because at the end of the day, we have the finest healthcare system in the world. We've got to find a way to keep it in place and be able to pay for it, and that's our struggle. Just have one quick question, just to follow up on Chairman Graves' initial question about the IT stuff. In talking with some of my doctors, and this is directed to Dr. Heyman here, when he made the statement that it saves money and it's more easy to access and do things with yours. The doctors in my district, I've got one large practice or a large group of them, and they were telling me that most of them that do it have found it rather cumbersome from the standpoint it takes time, and the longer it takes to do this, the less patients they see. Therefore, in essence, it doesn't necessarily save a lot of money from the position that obviously the fewer patients they see, the less money they make. So can you address that? Are they wrong, or we just got a learning curve here? We're not up to speed, or what do you?
Well,
I
think you just hit it on the head. It is a learning curve. There's no question about it. In my first 2 weeks of doing this, I was seeing one patient every hour, just so that I could learn the system. There's no question that there's a learning curve. But after you're familiar with the software that you're using, and almost all of the really good software is the same way. Once you're familiar with it, it becomes very, very easy to just, it's like talking almost, or typing. You just get used to it. But it takes a while, there's no question about it. And the other problem for a practice like you described is that it isn't just, in my case, because I'm using it, I have only a single employee. So I have only one person I have to teach. In the practice you're describing, they not only have to teach all of the physicians and all of the ancillary people that are actually providing the care, but on top of that, they have to teach everybody in their practice how to use this thing. And it slows everybody down. It's not just the provider. It slows everybody down when you first start using it. So I would agree with them. I'll tell you another barrier is that people know that eventually they're supposed to talk with each other, all these different software products. And a lot of people feel that they're not talking to each other now, so maybe it's a good idea to wait until they are talking to each other and that they know they have the final version. I don't happen to agree with that, but I sure as hell understand that. If it were me today and I were in that situation and I didn't know about the software, all of these major products will eventually talk to each other. But I would be holding back myself.
Well, I think you hit on another point that I was going to get to shortly also with regards to being able to integrate the different software programs, because I know there's, even within some of the hospitals I've been talking to, they have different areas of the hospital that can't even talk to each other because their software programs don't connect. I mean, that is a tremendous inefficiency within the hospital itself. So it's a huge barrier for care. It's a huge barrier for being able to do the kind of job that they're really supposed to be doing. So I guess my comment would be that, how do we get past that? I know with the advances in software, you're going to continually, in my business world back home, we have new software changes every 3 years. We just rotate one in and rotate the other one out after 3 years. I mean, if this is the case here, how do we keep up? I mean, you're talking about a long learning curve here. Are we going to be that inefficient from now on?
Well, I believe that it will increase efficiency. I believe that any physician that does this, once they've been doing it for a while, they would never go back to paper.
Okay. Dr. Prescott, you've got a hand up there.
Yes, thank you very much. I agree with Dr. Heyman. Just for disclosure, I don't have an electronic medical record. I am in a group that is looking at them for primary care. It may be why you sat me next to him, but health information technology is extremely important for surgical practices because we rely on hospitals and hospitals rely on us. Most of what we do is done in a hospital. And any health information technology I have in my office must speak to the hospital system, be able to relay information as well as radiology results and x-rays. So the interrelation, not just between physician small business practices, but between these practices and the hospital systems. Until it does that, it probably won't be worth the expenditure.
Thank you. Thank you.